everyone. Welcome to another episode of Five on the Front Line, produced by AIHA. I'm your host, Mark Ames. Today, we're talking about how to better communicate with workers about COVID-19 exposure risks. Our guest today is Fred Boelter. Fred is an expert in occupational health and safety with nearly 50 years of experience in the United States and more than 30 other countries. It is a real pleasure to have you on the show, Fred. Welcome.
Well, thank you, Mark. I'm glad to be here.
Fred, something that a lot of people probably don't know about you is that you're both a worker health and safety expert and a huge supporter of the performing arts. So kind of a fun question today. What lessons can you pull from Shakespeare about how to improve the government's communication about COVID-19 risks to workers?
Thanks, Mark, for that question. You're right. Both my wife and I are active in the arts, and there's much to be learned from the arts about the human condition and about humanity. Interestingly, with respect to Shakespeare specifically, Romeo and Juliet, you'll recall where the friar is trying to deliver a message to Romeo about Juliet, and he's actually interrupted and prevented from getting to Julio to convey the message because of a pandemic. In a pandemic, no one is safe unless everyone is safe. People's lives and the environment depend upon the credibility and reliability of our profession. Healthier workplaces, a healthier world. Communicating with people, be they our colleagues, workers, employers, the public, or regulators, require people skills, perhaps even more than technical skills. Effective communication requires that we need to listen, care, and build trust. Scientific and technical communication skills focus on providing information and perspective to help people make an informed decision and willingly change their own behaviors. 5 keys of such communication are to inform, offer balance, disclose uncertainties, state evidence quality, and to understand the concerns of the receiver of the communication. Data matters, but numbers and statistics can be confusing and potentially misleading. It is the interpretation of data that tells the story. Personal stories convey thoughts. Thoughts lead to feelings, which lead to actions, which lead to results. People have the tendency to want zero risk, which is impossible to achieve in life. Fundamentally, risk means different things to different people, and thus by the same token, safe does not mean zero risk. Something that is obviously safe may not be obviously so to everyone. When making decisions in managing risk, an understanding of defined objectives and outcomes is critical right from the beginning of the risk analysis. We are part of a global community that still has a long way to go before this pandemic is conquered. It is an interconnected world. Resources, supply chains, labor, consumers, health are all interconnected. Healthier workplaces and a healthier world are interconnected. There are ethical considerations in societal and public health policy distinctions between public health focus and a clinical focus, a distinction between prevention and treatment. Risk management and creating a safe condition rarely succeeds when relying upon only one control from our hierarchy. Frequently, a blend of options is necessary to confidently achieve desired outcomes or objectives and reduce uncertainty. A combination of personal responsibilities and shared responsibilities are necessary for success. My own rationale a couple of days ago, getting my first dose of the vaccine, was that I would rather accept the risk with COVID-19 vaccine that has not killed anyone than with the virus responsible for more than 400,000 deaths in the US alone and more than 2 million deaths worldwide. The vaccine is going to save my life and the lives of other people. The evidence so far suggests vaccines are akin to a cure. People who have received both of their vaccine shots will be able to do things unvaccinated people cannot. I will be able to have family meals and hug my 3 grandchildren. But until this global pandemic is defeated, people should wear masks in public, help unvaccinated people stay safe, and contribute to a shared international project of saving lives through prevention.
Thank you so much, Fred. Those are wise words. Thank you for sharing them with us. And I feel like one of the recommendations that you didn't mention that I feel like maybe you would is to encourage other folks and maybe everyone to engage in the performing arts if they're not already doing so, because I feel like maybe they can learn some interesting perspectives. So thank you very much. That's all the time we have for today. Thanks for coming to the show, Fred.
Thank you very much, Mark.
And thanks to everyone for joining us. Five on the Frontline is produced by AIHA. Subscribe to our YouTube and podcast.co channels to catch the latest expertise from our frontline industrial hygiene and OEHS science professionals. I'm Mark Ames, wishing you a safe and healthy day ahead.